Hi, this is Dr. Nick. I'm the Incrementalist here with Incremental Insights for better business, better health.
And I'm Fred Goldstein with Accountable Health. Thanks so much for joining this week. I'm here to help employers and employees bring their employees back to work in a safe environment, look at their benefits plans. So, Nick, recently changed to some of the guidance around the two vaccines, I believe the Pfizer and Moderna one, having to do with myocarditis. So, what is that and what does it mean?
Yeah, so what is myocarditis? Inflammation of the heart muscle. So, in medicine, a lot of history, I was an old school guy. I actually learned Latin, and that made some of the terms that we used make sense because they were Latin terms. And if you understood the Latin, you could determine what that meant. Myocarditis, is to do with the heart muscle. So it's basically the actual muscle. You might also hear a term pericarditis. That's the lining that surrounds. So all of this muscle, and then we have a pericardium that sits around the heart organ, and those can get inflamed in the same way that your muscles get inflamed. If you have an injury, you'll feel aches and pains. But in the case of the heart muscle, that's a little bit more of a problem because that's beating all the time. It's kind of essential to life. And what you're talking about is the new guidance. It's now been put on the warning labels for those vaccines by the CDC. I think we saw it in other countries, particularly in Israel, that they've seen it. And it veers a little bit to the younger generation. Interestingly, there's also a gender difference. So it seems to be in the males versus the females, although not exclusively. Again, one of these things that we don't sort of exclude just because you're a female, younger age group doesn't mean say we would exclude it, but it's less likely. So these are all statistical. But here are the highlights in all of this. So we've seen clearance of the vaccines, Pfizer specifically, for 12 and up. So parents that are thinking about this, should I get my kids vaccinated? Well, if I had children of that age group, and I have in the past, they've increased in age, so they're no longer in that group, I would say absolutely, I would be getting my children vaccinated because the risks are very, very small and far less than the impact of this COVID-19 infection and the long-term problems that we'll talk about in a second. So I think it's about 1 in a million. And importantly, it responds well to therapy. You just have to stay aware of potential symptoms. So, if you're getting a little bit of chest pain, maybe shortness of breath, fluttering, people sometimes feel their heart or pounding, that can be a warning sign. And you should seek medical care. But in almost all of these instances, they resolve of their own accord. We don't have to do anything. There's no long-term instance. It just seems to be causing some inflammation that resolves. But the statistical numbers here are very clear. If you look at it from a relative risk standpoint, this is a low risk in the same way that we see that with other vaccinations. There is, nothing is risk-free. You can't walk out of your house without, well, actually, you can't live in your house without being at risk, let's be clear. So this is always a risk-reward. Very clear statistically, in my view, that this is something, yes, we need to watch it. Yes, it's important, but, the risk-reward is very clear. Get your kids vaccinated. If they're 12 and above, I would be doing so.
Mm-hmm. Yeah, it really makes some sense. And I was wondering, so really as a parent, they just need to understand potentially what some of the symptoms are and to really watch for those, I guess, once they've had their children vaccinated.
Exactly. And, let's talk about the downstream impact of this and why the risk reward is so important. When we think about long-term consequences, we've seen all of this long COVID. There's a number of names, but I think most people can understand that. You've been looking at this. There's been some interesting therapy, right, for long COVID.
Yeah, still early, but an interesting thought is, obviously a number of these individuals end up having difficulty breathing, and talk about not being able to walk across a room or things like that. there have been examples of using music therapy in the case of people with asthma and COPD to help them better develop their breathing. And so a couple of music therapists, or one that was in this article, has actually started. He interestingly suffered from long COVID and had issues breathing, and began to do simple songs where he would sing and see how long he could sing something simple, and then added longer and longer songs. And he's now put a group together of individuals. And also, obviously, this is therapeutic from a mental health standpoint. You're connecting with other people, similar issues, things like that, and can discuss that as well. But ultimately, working up to longer and longer songs, and even trying to sing when you walk, which has been helping to build back some of that breathing. Apparently, there's still some studies going on about this.
So, I'm just going to make some suggestions. So what you should do is work up to Bohemian Rhapsody from Queen, because if I recall, that's the longest song. And I have to say, I'm going to date myself here. That was the first song I think I learned and knew all the words. I think I still do, but don't challenge me.
Wow, so we're going to get a
work
video
up to the extended edition of Bohemian Rhapsody, which, by the way, doesn't make any sense, but it's still a fantastic song.
Unbelievably great. So we're going to sit in the car and go like this. We're singing along. It's one of the all-time greats. I wish I had anything 1/1000th of a voice that he has. Unbelievable.
Freddie Mercury was something special. So yeah, the interesting thing that you highlight at the end of that is being able to sing and walk at the same time. One of the things that we talk about from an exercise standpoint is if you're running, you should still be able to talk. So actually having that capacity, so that's inducing the appropriate level of exchange in the lungs, and that seems to be doing great. What a great idea, and people don't have to listen to you. They certainly don't want to listen to my voice. I've been told that very clearly by my family, for sure.
Never mind. Neither one of us is Freddie Mercury. There was only one. Unbelievably incredible. So once again, thanks so much, Nick. It's been a fantastic week. This is Fred Goldstein with Accountable Health. If you'd like more information, please go to accountablehealthllc.com.
And this is Dr. Nick. I'm the Incrementalist here with incremental insights for better business, better health.